Many seniors want to improve their flexibility, but a lot of common flexibility exercises require you getting down onto the floor. And if you don't have the flexibility to get down on the floor or the strength to get back up from the floor, that can pose a problem. Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you 9 flexibility exercises that you can do sitting in a chair that help improve your flexibility from head to toe. And the best part is you can do the whole routine in less than 10 minutes. Now, this is very much a how-to video, so I'm just going to jump straight into the stretches, and I'll explain a little bit about why they're important as we're going along. So starting up at your head, first is the ability to turn your neck. And that's really important, particularly for driving, to be able to check your mirrors or to be able to check your blind spots. And a lot of people either lose mobility in their neck because of degenerative disc disease or arthritis, or they have pain when they're turning from side to side. And so a simple exercise that you can do is pretending there's a rod straight through the top of your head and trying to turn right around that rod. You don't want to get an up and back type of movement, which is what many people do. So pretend there's a rod right through your head. You almost want to think about turning chin to shoulder and then chin to shoulder. So going one way and then the other way, back and forth, trying to get a pure rotation, not like that and also not like that. Trying to go nice and slow, giving a pure side to side rotation. And what that does is it opens up the joint spaces in the back of your neck by keeping your chin slightly down. You don't pinch the facet joints or pinch nerves as you're turning from side to side. You want to make this a nice, gentle, simple turn. You don't want to push it as far as you can possibly go. Just go in the range that feels comfortable to go, and it will get easier with time. Now, 5 to 10 repetitions each way is probably fine if you're doing this on your own. I probably did more just while I was talking, but just do 5 to 10 repetitions so you can keep your total exercise time down. So next we're going to go to the shoulders. Another common problem that people have as they age is they lose the mobility to reach up over their head, reaching in high cabinets or putting things away in the closet because of either arthritis in their shoulders or rotator cuff problems or just limited mobility. They have trouble reaching up high or get pain in your shoulders reaching up high. And so the key points with this are you want to have your palms facing. Palms in like that puts your shoulders in a bad position where you're likely to pinch or impinge your rotator cuff tendons. So you want forearms parallel, not elbows out. And then you want to think about raising your shoulder blades in your arms, not just moving at the shoulder joint, but letting your whole shoulder blade reach up towards the ceiling and reach up as high as you can go comfortably, and then come back down. Reach up as high as you can go comfortably. Hold 5 to 10 seconds at that top position, and then come back down. And again, repeat this for 5 to 10 repetitions. Back down, go up, and back down. You may notice as you get higher, you may have the tendency to let the elbows flare and the palms turn in, but you want to resist that. Just keep your forearms parallel, palms in. Even if that means you can't go quite as high, don't let the elbows flare out like that. A couple more times. And so that's the second exercise for your shoulders. Now, the next exercise is kind of for your shoulders and your upper back combined. And that's a chest stretch or a pectoral stretch. For this, you want to make sure you're sitting all the way back up against the chair so you have your lower back flat on the chair, and then put your arms up like this, like a goalpost. Now you're going to think about bringing your palms backwards or your wrists backwards. You don't necessarily want to pull your elbows backwards, but think about rotating your wrists backwards behind you while keeping your chest up. Your lower back should stay flat against the chair. And you just rotate the arms back that way with your chest lifted. And ideally making this a static hold, holding for about 30 seconds. Now, if your arms get tired or you just don't have the strength to stay here, do it as long as you're able to and shoot for a total of 30 to 60 seconds total time. So if you do 10 seconds, do 3 to 6 sets of 10 seconds. And so that's the third stretch. Now the fourth stretch actually is for your upper back, and you want to be able to twist well at your upper back. Your upper back joints were made to rotate very well. The joint surfaces are kind of aligned like this. Your lower back was not made to twist, and twisting at your lower back can set you up for lower back problems. So most of your twisting should come from your trunk as well as from your hips. But for the purpose of this exercise, we're just going to focus on the trunk. And so cross your arms and just think about twisting your shoulders while keeping your lower back flat on the chair. So it's not a big twist and turn all the way as far as you can around in the chair. Keep your lower back flat on the chair and just twist the chest and shoulders as far as you can comfortably. This should be a fairly easy movement. Go back and forth about 5 to 10 times each direction. Next, moving down, we're going to go to the lower back. And when you stand upright or you sit upright with your lower back arched, that jams the joints in your lower back together, which can be really painful if you have degenerative disc disease or if you have spinal stenosis. Conversely, bending forwards helps open up those joint spaces so that you don't have those joints jamming together, that you're not pinching on the nerves in your lower back. And so an easy way to do that is just sitting and bending forwards and touching your toes like that. To see that from a side view, you just bend forwards and touch your toes. And again, this is probably a static stretch as well. So just getting in that position and holding it for 30 to 60 seconds. If you do have some limited mobility in your hips, or maybe you have a little bit of a belly on you, spreading your legs out a little bit allows you a little bit more space that you can get down. It also kind of opens up the hip joints and gives you a little bit better hip mobility than if you're sitting like this and kind of getting blocked by your thighs. Now, next we're going to move to your side trunk muscles. And this is particularly important for people who have, say, one-sided lower back problems. If you have lower back pain on one side and your muscles are stiff on one side, it jams the joints just on that one side together, or you may just feel like you have a big spasm in the muscles right along your back on one side. And so a great stretch for that is a stretch of a muscle called the quadratus lumborum, which runs from your rib cage to the top of your pelvis. It's really deep and sits right along the spine. And an easy way to stretch that is reaching up and over top of your body. Now, it is oftentimes a little bit more comfortable if you go slightly in a forward direction. So what I a lot of times tell people is just rest your elbow on your thigh and come up and over the top. That way you're going forwards just a little bit and you're also going to the side. And you should feel a nice stretch both in your lat right here as well as in the side of the trunk. Now, if you don't have any lower back pain, this is a good exercise to do to both sides. If you do have some lower back pain, especially if it's painful while you're doing the exercise, you just want to go the way that's not painful, which often is going away from the painful side. So if the pain is on this side, you want to stretch towards the opposite direction. Now, next, we're going to move down to your hips. And the two muscle groups that we're going to stretch here are your hip rotators. Commonly, the piriformis is the one that gets called out, but this does stretch all 6 of the hip external rotators, which are deep inside your butt. And the way that you do that is crossing one leg over the other. Now, you might have to grab onto your pants or grab onto your leg to help lift it up there if you're a little bit stiff, but try to get it up as far as you're able to, and then let this knee drop down. And that knee may not go all the way down to parallel. Don't force it anywhere. You don't want to get pain in your groin when you're doing this. Now, you may feel some inner thigh stretching. You should feel some stretching in the back of your buttock, but you really don't want to get pain in your groin, which is a common symptom of hip arthritis. So lift up and then just push down just to the point where you can comfortably. And again, you should feel a stretch in your inner thigh and or in your buttock, but don't push to the point where you're getting groin pain. And this again is another static stretch. So hold it for 30 to 60 seconds on one side and then switch over to the other side and hold for 30 to 60 seconds on the other side. And next, we're going to move to your hip flexor muscles. These muscles, your iliopsoas muscles, run from your spine and go down and attach to your hips. And that can give people a forward tilt of their pelvis and an arch in their lower back, particularly when they're standing for long periods of time. So if you have spinal stenosis or degenerative disc disease and you have pain standing for long periods of time, it's very likely that you might have tight hip flexors. Now, I've got other videos that show you how to do a standing hip flexor stretch. But in this particular video, since we're focusing on chair stretches, I want to show you how you can do it sitting down. And you need a chair that doesn't have armrests like this one. And then you just put one leg down, kind of like you're kneeling on it. You can actually also do a kneeling hip flexor stretch where you're kneeling on this leg and this one's up on the floor. But again, this video is for people who can't get down on the floor or don't want to get down on the floor to stretch. So you do this just by hanging one leg over, and you should feel a stretch in the front part of this hip and thigh, and then move over to the other side and stretch that other side. And again, static stretch, so hold 30 to 60 seconds per side. And then we're done with that one. Now, the final stretch that we'll go through is your hamstrings and calves. And a very simple way to stretch your hamstrings and calves is just raising your leg out in front of you and pulling your toe back towards you. You can do this kind of as a dynamic stretch, moving back and forth like this. And this is good for the health of your sciatic nerve. It just gets it gliding back and forth. If you would rather do more of a static stretch, you can use a towel or a stretching strap like this one. And you just put that around your foot, pull the leg up, and then pull the toes back towards you. You can also do it with your foot on the floor, pulling your toes up and leaning your trunk forwards like that. And you should feel a stretch in the back of your hamstring as well as in your calves. So that was the simple chair stretching routine from head to toe for seniors who don't want to or can't get down on the floor to stretch. Now, if you need more help to improve your flexibility so you can stay active, mobile, and healthy as you age, if you're in the St. Louis area, we'd be happy to help you out here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.